Hi, my name is Rob. I am a graduate of UNLV Physical Therapy, year 2013. Background is mostly in outpatient orthopedics, but I also have background in acute therapy, acute rehab, and home health therapy.
Hey guys, and I'm Baron Shaw, also a graduate of UNLV, class of 2014. Just like Rob, most of my clinical experience is outpatient orthopedics and sports, but I also do acute care, wound care, had a little bit of experience in acute rehab, and I'm also doing home health. So we're going to talk to you today about why your DPT is worthless and what you can do to change it. This is just a recording that we're doing based on the presentation we gave a couple weeks ago at UNLV during a brown bag lecture. Okay, so what is your why? This I took from a TED talk that I listened to a little while back about a lot of the biggest businesses and the biggest companies in the US basing all of their marketing and PR on why they exist. Not on what product they sell, not on what other services they sell, but on their why. Why is the biggest driver? So, similar to that, we want to ask you before we kind of get into the nitty gritty of why did you want to become a physical therapist? Why did you go through 4 years of undergrad and 3 years of grad school to be here? Why did you decide to take on this much debt? So when we gave this presentation live, a lot of the answers and the responses were to help people, to help make a patient connection, to spend more time with patients than physicians do. It was a lot about making a connection with patients and helping them achieve their goals. So I want you guys, as you're listening, to think about what your specific why is, why you came into this profession, and hold on to that as we move forward.
What is your ideal treatment environment? So this has a lot of different factors involved. First of all, what setting do you want to work in? Do you want to work in outpatient? Do you want to work in a hospital? Do you want to work in a school? There's a lot of different environments that we can work as physical therapists. You know, you can work on a sports team, etc., etc. Supervision, so this pertains to the staff that's going to be under you, including PTAs, techs, and students. How much responsibility do you want to have? Do you want to be a clinical instructor and pass on your knowledge to students? What patient population do you want to work with? Again, big variety here. You know, geriatrics, pediatrics. Do you want to work with athletes? Do you want to work with spinal cord injury patients? Caseload. What kind of caseload do you want? We asked the students actually what they thought a manageable caseload is, and a lot of them said about 2 patients an hour is a proper amount for a caseload. And an outpatient, I would agree, but we know this is not the case when it comes to a lot of environmental settings for PTs to work in. You know, a lot of times we're seeing 4 or more patients an hour. So hours, how many hours do you want to work in the day? Do you want to work part-time? Do you want to work full-time? Do you want to work 410s? Do you want your documentation time to be included in those hours? Which brings us to documentation. How much time do you want to spend documenting? You know, and again, is that included in your time that you're supposed to be at work? Do you have to take your documentation home to finish it? These are all factors that are going to affect what your ideal treatment environment is. And the reason that we want you to think about this is because if you're not happy doing your job and if you're not happy with any of these things, then that's going to affect you as a physical therapist and how you do your job. And it's going to affect your why. So just want you to think of all these things, okay? And flexibility, time off, continuing education. Again, does that time off include or not include time to go to these continuing education classes that you need to? Do you have to take time off from your PTO to be able to go to those things?
So now that we've kind of set a baseline of kind of why you got here and what you're looking for in the future, let's talk about value. So value, what's the first thing people think about? Automatically, it's money. It's always money. How much money does it cost? How much money am I going to make? What is that bottom line? Okay. We kind of want to change the script a little bit with this conversation, because money is not the end all be all. Money is not what we should be using to drive our decision making. A lot of the problems that we see in physical therapy are caused because of people kind of ditching their why, losing out on their why, losing out on their vision of what they saw as their ideal treatment settings, and chasing the money. So we want to kind of start talking about a different way and a different measure of value. So what brings down the value of a DPT? So to start off with, it's poor educational standards. Not necessarily saying that all of the schools out there are bad, and not necessarily saying that the school you attend to is not giving you the education you deserve, but more to the point of poor educational policies. So meaning physical therapy assistants are now trying to push to become a bachelor's program. There's even in town in Nevada, there's a PT Tech program. These programs are a little bit ridiculous because we're not getting reimbursed anymore as physical therapists. So why are we pushing people under us to get more financial debt, to go back to school for longer amounts of time, more debt, without being able to pay them more? If they're demanding more, where are we getting this money to pay them? It's driving our value down, because now the gap between what we're paying physical therapy assistants and PTs has to narrow, because now their financial burdens are more and they're demanding more before they get hired on, things like that. So like you see, i.e. increased debt, which is bad. And on top of that, our education doesn't include, or for the most part does not include, education on financial management, financial advice for the future, how to manage this debt, how to come out and negotiate an appropriate salary, how to look at these numbers and figure out a way to build a comprehensive package for yourself and your families. So this is what we mean by poor educational standards. That kind of leads into corporate policies that also kind of reinforce these things. Like I said, reimbursement rates aren't going up because a lot of these corporate policies or these corporations, are signing bad contracts. Those bad contracts are to the point of where I know a company in town that's signed somewhere around $20 per patient per hour of contact, which is absurdly low and ridiculous for us to be accepting that kind of pay rate. Right there, devaluing our profession just by signing on the dotted line there, without ever educating the patients, without ever educating the insurance company, nothing like that. Just signing on the dotted line, bad business, and that results to low pay. And remember that number, $20. We'll come back to it in a couple of slides, and I'll show you why it's important. But low pay is as a result of the low reimbursement. These companies need to meet their bottom line, so they're not going to pay you anymore because they're not getting paid anymore by the insurance companies. So all about the bottom line.
So again, bad contracts, low pay, bottom line leads to volume, patient mills. You know, we've all heard of these or aware of them. So you have decreased use of PTAs, again, because the cost isn't worth it. Overuse of techs and aides, so they're doing jobs that they're not supposed to be doing a lot of times, trying to manage the patient load. Then you get generalized, not individualized care for patients. You have skilled versus non-skilled interventions. What do we get when we're managing 4 patients an hour? You get a lot of modalities. Put this person on heat, put that person over there on stim, do ultrasound over there. I'm doing a lot of modalities, which is not what we specialize in. Then the 8-minute rule, okay? Everybody's familiar with the 8-minute rule. You have to do 8 minutes of something for you to be able to bill for it. All right. So all of these things are bringing down the value of your DPT.
And when we presented this live, we asked the audience about how many of them were techs and aides prior to coming into PT school, and I'd say it was about 80 to 90%. And I'd say 99 to 100% of them also said that they were overutilized as techs or aides and did things that they probably should not have been doing. So that's a huge liability issue, a huge Practice Act issue coming down the line for the therapist and for those techs and aides. If something ever happens, you got to think about that stuff. So going back to value and low self-value, we do a really bad job of promoting ourselves and taking pride in what we do. Going back to the age-old discussion of using doctor as a title, Up until about 6 months ago, I was on the fence. I was even saying, no, we don't really need to use doctor. Need to break the mold. Already people have negative associations with the title of doctors and not really spending a lot of time with them and that kind of thing. But then you go back and look at chiropractors and how well they've marketed the use of doctor and how well they've utilized that title to demand respect out of thousands upon thousands of people in different industries that kind of go and rely on them. So this is something that I think is huge, valuing ourselves and valuing the degree we're getting when we come out of school. Use the doctor, and a lot of times even older PTs will tell newer PTs, "Oh, don't use doctor. You're self-confident. You're coming off as cocky and things like that." And I think that's ridiculous. If we're getting the degree, we need to be using the title. Same thing, branding. A lot of times we brand the company or the treatment or the protocol that we're using and not ourselves. Everyone's heard of the FMS and Fusionetics and these types of programs that kind of simplify what we do as physical therapists. We need to be branding ourselves. It's not the FMS that's providing the treatment. It's Baron Shaw, DPT, or Rob DPT that's providing this treatment. It's not Select Physical Therapy or ATI Physical Therapy. It's that individual provider that's giving them this treatment. So we need to do a better job of branding ourselves as individuals and asking those patients to go get us specifically more patients. And then this is kind of, I could get on a soapbox on this with the next bullet point of responsibility in the blame game. We point fingers in every direction for the things that are wrong. Insurance company, Medicare, Medicaid, the government, MDs, society, education, this, that, the other. But we never point the finger at ourselves. I was talking about that $20 contract. It wasn't an insurance company or an MD or anyone else that signed on the dotted line. It was a physical therapist that signed on the dotted line. So again, going back to the educational standards and no finance education and $20, you can't run a business for $20. I guarantee you it costs that physical therapist more than $20 per hour to run the clinic. So we need to start taking credit and saying, listen, we've screwed up in the past. We need to fix this. And then professional development. We're terrible as a profession at getting out there and developing ourselves as professionals, as clinicians. Everyone always has it's too expensive to be part of our association. It's too much time. It's not. If we want to get paid for 20, 30 years down the road, we need to be involved. So those kind of things present roadblocks to the value of your degree.
So low business IQ, again, we don't get any formal education a lot of times in finances. So oftentimes we come out of school with poor negotiation skills. We don't know how to do an interview. We're short-sighted. We come out of school, we have a lovely student loan to pay off, and so we look at the first thing that comes our way. We're not looking beyond. We're just saying, I need a job. I got to pay my bills. So we're not looking at all those things that we were thinking of before, like what is your ideal treatment environment? We're looking at, I need a job, I got to pay my bills. So oftentimes, we don't negotiate salary. We don't negotiate, hey, okay, how much time are you going to give me for documentation, and actually hold them to that. All the things that they will offer you you actually need to make sure they follow through with. So limited to no PT to PT collaboration. Again, we are looking at each other as competition. You know, there's very little collaboration from PT to PT, or even PT to other medical professionals. You know, we have this clinical perspective. We want to do everything in our clinic, right? We're not outsourcing. Hey, there's somebody who could use vestibular rehab. You know, how many times are we outsourcing to a specialist over there? Or, you know, somebody who knows a certain technique that could benefit your patient. Again, how many times are you actually outsourcing to that other person? Because again, everybody's competition for us. You know, business strategies that we use as PTs, again, you know, we're not marketing overly. We're not so we're not marketing to the public about all the things that we have to offer. You know, we're not collaborating with other professions and other businesses to promote ourselves. We're just kind of stuck in our clinic, our business, and everybody else's competition.
So we kind of talked about what's bringing things down, and of course we're a evidence-based profession, so here's some evidence pulled off of the Bureau of Labor Statistics from the government on different educational levels, how many years of schooling you have to go through, and the mean hourly wage and the mean annual wage. These are national averages that I selected. You can go through, look through the website. They have specific to your state and your city even, if you were looking for more detailed information. But if you look at this, and it's in no specific order. I did it at 4 o'clock in the morning. It was just thrown on there. But for physical therapists, we're 7 years between undergrad and grad school at the quickest if you don't take any time off or have any roadblocks throughout the way. Hourly wage, the mean is $42 approximately. Mean annual wage, $88,000. But look at this. Going back to that $20 contract that someone signed. A massage therapist only has to go to school for approximately 500 to 1,000 hours, and it's a certification, and they're getting paid more hourly than that therapist contracted. So for us to go to 7 years of school and to take something less than a massage therapist is making, no knock on massage therapists, I use them all the time, but this is just a ridiculous thing to look at and compare to and say, how is this happening? Why is this happening? This is exactly what's causing us to devalue our own profession and for other people to not look at us as very important in the grand scheme of things. This is it. This is it right here. So this is the empirical evidence of what's happening to our profession.
So how do we affect change? Right? How do we start to change some of these things? The first thing that we have to do is just say no. We have to learn to say no. Again, it was a PT who signed that contract for $20 an hour. We have to say no to those things. We have to start valuing ourselves if we're going to change anything. But that starts with us. We have to point the finger at ourselves and say, I'm going to say no. I'm going to demand more.
So that means taking responsibility. As individuals, you start with your morals, your values, your ethics, that big why at the beginning that we talked about, including your fundamental whys that you grew up with. These are things that we need to stick to throughout not only our professional interactions with patients, but also with how we go about negotiating contracts and what we're willing to sacrifice and what we're willing to do. And as clinicians, again, we're talking about providing skilled care. We need to take responsibility and stop doing these quote-unquote Hummer treatments. Everyone laughs, but everyone has seen it. Heat, ultrasound, stim, massage, instrument-assisted massage, cupping, dry needling, all these modalities all of a sudden without any other skilled care, because like we talked about, 4 or 5 people in an hour, you got to do something to keep up. So we need to get back to that skilled care, truly providing value to our client, why they're coming here. If they're doing the same 5 exercises that you gave them at home, it's not skilled care anymore. They should be doing that at home. We don't need to repeat that in clinic. Okay. And another thing we recently kind of started discussing after a visit with another prominent therapist was don't call it an HEP, home exercise program. People don't exercise. People don't like the term exercise. People don't like home exercise program. It's a bulky term. It's a bulky thing. People don't comply with it for the most part. And most people already understand that after 5 or 6 exercises or activities, they're not really compliant with anything more than that. So we're starting to talk about it and call it a prescription. Don't give them 100 exercises to do. Give them, hey, you've got scapular instability, you've got hip stability issues or shoulder stability issues, you've got poor patellar tracking, you've got ankle instability, and that's their prescription. You need ankle strengthening, you need scapular stabilization, you need hip strengthening, and then they can take that prescription and go to any therapist in town. They can come back to us, doesn't matter, but then they know, okay, these are 2 or 3 things that I need to work on. The exercises are part of that prescription. They are how they fulfill that prescription. They are the quote-unquote pill that we give them for that prescription. So kind of just changing the mindset of how people are viewing this.
So as members of an institution, so schools, we all graduated from a school. If you see something that your school will benefit from, mention it to them. There's programs in Florida that have the McKenzie A and B incorporated into their curriculum. They get their A and B certification right out of the door. If anybody's not familiar with McKenzie, it's another school of thought, but McKenzie, I feel, is good because it teaches you and reaffirms a lot of your assessment techniques. It's good for clinical reasoning. So, again, give back to your school. Take responsibility. If you want your program to become better, be active with your faculty. Companies. So, companies that we work for, again, overall, we have to take responsibilities as individuals, okay? If your company is not doing something, not following through, something like mentorship, all right? We are the ones that have to hold them to that. We're the ones that have to make sure that it happens, all right? Because if we're not doing anything about these things, we're just part of the problem. You want to be part of the solution. So be active. You have to take responsibility and not let these things slide. Okay? We have to make sure that we're following through with everything.
Be the change. Be the change. So, and going back as a profession, we talked about a little bit at the beginning, but professional involvement. One of my favorite kind of lines that I took away from I think federal advocacy one year was, if you're not at the table, you are on it. Meaning if we're not at the table discussing these things on a city, a local level, a national level, an international level, we're on the chopping block. Someone else is going to be talking about us for us. And that I think is also where we come into problems, is someone that's not a physical therapist is making decisions for the physical therapist, and that's a huge problem. So get involved at any level. There's so many ways to get involved and make a change, whether it's, I only have an hour or 2 here or there, to I got all kinds of time and give me everything that you got, I'll do it. Talk to your local associations, your state associations, your national association. There's always ways to get involved, whatever level it is. Another big thing, me and Rob will harp on this all day, all night long, patient education. period. This is the biggest thing I think we can do. And going back to McKinsey as well, is it's a lot about patient education and enabling the patient to help themselves. Okay, it's all about the why. We talked about your why earlier, why you came to PT school. We have to teach the patients why they should do this exercise or this activity or fulfill their prescription for therapy. Why are they here? Why are they doing these things? If they understand why they're doing this exercise, they'll be enabled and they'll say, you know what? I do want to go up and down those stairs again. I'm going to do this 3 times, even though my therapist told me twice. If you tell that same patient, I need you to go do squats, lunges, and this, and never tell them why, do you think they're going to go home and do those things? No, because there's no purpose. There's no end goal for them. So we need to give them that end goal. Give them their words back to them. We're doing this so you can achieve this. Okay? And then along that, educating the public. Most of the time, people don't know who we are and what we do. I can't tell you the number of times we had patients come in and say, I don't know why I'm here. The doc told me I had to come before I went back to work. So I'm here. Tell me what I got to do. And that's a sad, sad thing. And that's a huge miss on a professional level that we need to fix. We need to fix big time. You know, we go out and seek physicians. We go out and Yelp them and check them out on Google, and we do all of our reviews and ask everyone else about where we're going and why we're going and who we're going to see. Most of the time, these patients come in because the physician pulled off the top page of a script pad that was at the top of the pile in their drawer and sent them. They're not giving them any information. There's no quality control. There's nothing like that. So we need to do better at educating the public and getting them to understand what we do, why we do it, and why we're important in their lives and in their overall health care.
So improve your business IQ. So interview skills. You need to fit what they're looking for, okay? But you also need them to fit what you are looking for. So a lot of times, again, we come out of school, we are not familiar with interview skills. We don't do enough research. Like, how much research did you do before you went to PT school about what school you wanted to go to? You know, how much research did you do then? Now, when you're looking at a job, why are we not doing as much research on companies and what questions to ask? A lot of companies will give you these very, very attractive packages. Hey, we offer, you know, this salary. We offer continuing education reimbursement. We offer mentorship. We offer this PTO. But now you need to get specific. Again, you know, is that PTO or continuing education? Do you have to take off your PTO to go to those continuing education things? So you really have to learn to ask the right questions and do your research on companies to find out, are they the right fit for you? Are you the right fit for them? You know, go shadow. There's a lot of places that, you know what, you just tell them, hey, I want to spend a day at the clinic or the hospital and see what they actually do. So negotiation skills, again, know your value, know your limitations. Right out of school, you have a lot of knowledge to treat a lot of different patients, but you don't know everything. There's a lot of things that we have to learn. There's a lot of experience that we have to get. So know your value, but also know your limitations. You know, you're not going to come out of school asking for $90,000 a year, all right? But you don't want to sell yourself short either. Know all the different values that you have and skills that you have to bring to the table.
So what all that means is draw a line in the sand. Know how much you're willing to kind of give up and sacrifice versus where you say, nope, this is it, I can't take it. You know, going back to your why. Like Rob said earlier, how much time did you spend researching PT as a career? How much time did you spend researching the school that you went to? The area that you lived in when you moved there? All those kinds of things. And then how much time have you spent researching the companies and jobs that you're going to eventually work for? For the most part, when we did this presentation live, People have spent years looking into all these different schools and these different career options and things like that. And almost none of them had spent any time researching the jobs and the companies that they're going to eventually work for in the next year or two. So start planning ahead. We so oftentimes look ahead and plan ahead for PT school or graduate school of any kind, but then miss the mark because we never look beyond. We're so excited to get into graduate school. We're looking forward to our future, or we're talking about all the exciting things we're going to do when we have money, but we forget the middle part of finding that job and finding that company and finding a good place for not only yourself but your family and your entire situation. It goes back to your personal why. Each person's different. If your why is I never want to take vacation ever again and I want to work 24/7 and make as much money as I can, okay, fine. But for the most part, there's a lot of different nuances with what each person is looking for. So again, going back to what you are looking for out of your company and those interview skills, make sure you're talking to these companies about what you need from them and what you are looking for out of them. And then bottom line, is the juice worth the squeeze? You know, are you sacrificing too much of your individual ethical principles, your morality, your values, things like that? Are you losing that true sense of this is the type of clinical experience I wanted, this is the setting I wanted, this is the type of scenario and the group I wanted to work with, this is the type of mentorship I wanted? Is the juice worth the squeeze? You need to draw that line in the sand and make sure you go in and with that line already drawn and stick to it. The moment you start letting that line blur is the moment they start taking advantage of you. And this is coming from experience. It happens, and it happens often.
Add value to you. So there's a lot of different ways that we can do this. Biggest one, continuing education. All right, and there's a lot of different aspects that we can improve with this. So clinical, you know, obviously there's a lot of different classes out there that you can take to hone your manual skills, hone your clinical reasoning, and get better at treating patients. And especially if you want to go out there and certify as well, you know, there's classes that are geared towards that. If you want to specialize in sports, if you want to specialize in neuro, if you want to specialize in pediatrics, women's health, right? Wound care. There's a lot of different avenues that we can take here. So there's a lot of things that we do clinically, and we usually focus on this one. But there's other aspects too for continuing education, right? Leadership, improving our communication skills, improving our business and finance education. Again, learn about how businesses work. Learn about how companies operate. That'll give you a better understanding of why things are the way they are and what you can do to change them. Okay? If you don't want to be a leader, you know, there's still a lot of things that you can learn through leadership or about leadership that again will just improve your overall education and value. All right? Communication, we should all be very good at this, but oftentimes we come out of school and we do have a hard time communicating on a certain level with patients. All right, we tend to use a lot of medical terms and big fancy words, and we can't communicate to the patient directly in a way that they will understand.
Yep, and like Rob says, we oftentimes get stuck in that clinical rut of these are approved by the state board, and so I need so many CEUs, and this is what I'm taking. There's so many other classes and opportunities out there to improve yourself as an individual, as a therapist, as a leader, as a business owner, or even an employee that add value. So make sure you look outside the box there as well.
Yeah, they don't have to always be offered through like the APTA, or hell, you can go on YouTube, you know, TED Talks. There's a lot of different avenues out there. So next one, community involvement. So physician model in hospitals. This is talking about there's physicians that now contract just with specific hospitals, and all their patients will go only to that hospital because their physician is over there, right? So we don't have anything like that. We tend to, again, like Baron said, the doctor gives them a script to go to this specific physical therapy place. They're not going to see a specific clinician. They're just going to see Select Physical Therapy or that physical therapy place down the road. So, and this goes in hand to hand with what we were just talking about, is brand yourself. Okay, one of the biggest things that you can do to add value to you is brand yourself. So this is talking about that person that the doctor sent to your company, to your clinic, or wherever, you're in the hospital and you're seeing a patient. That patient is being treated by you, not the company. Specifically at that moment, they're there to see you. If you get them better, you're going to be the one that they tell their friends and family about. They're going to recommend you, not your company. They're going to recommend you. So brand yourself. And then again, advertise, market yourself to the public, to the MDs, to other professionals. We do a very horrible job as physical therapists doing this. The public has a very poor understanding about what we do. I think there was a segment on Dr. Oz a long time ago about what a physical therapist is and what we do. And what was on there? I mean, it was a whole bunch of modalities. You had ultrasound, you had e-stim, ice packs, hot packs. There's a couple TheraBands thrown in there.
Bumpy balls.
Bumpy balls. But is that what you think you do as a physical therapist? Really? Again, we need to start valuing ourselves and what we do, and that needs to be portrayed to the public and to MDs. We still take orders from MDs. They give us a script and we fulfill that script. They tell us how to do our job, when in fact, when it comes to, okay, whatever, we're not giving them advice on how many anchors to use in a surgery or to use a certain technique. No, we respect them enough to know that they know what they're doing, and then they should respect us enough to know that we know what we're doing with the rehab portion, okay? But until we start actually saying no and standing up to them saying, hey, don't tell me how to do my job. You don't have to say it in a mean way, but it's going to continue until we take responsibility and we say no.
So, like we briefly mentioned before, challenge the status quo. Like Rob had mentioned, there's so many different ways that we can function as physical therapists, not just in the standard clinical setting of, big business with 10 clinics in town and you're just part of that mill, okay? One of the things that we can do is document review, case files review. I've heard of several therapists doing this for insurance companies and legal matters and things like that, where you're just reviewing case files and documents from other therapists to see if the treatment provided was accurate or not, whether more treatment or less treatment was indicated, things of that nature. Corporate-based clinics. One of the therapists that I work for works on the Las Vegas Strip, working for a lot of the bigger corporations down on the Strip, working with their employees on site. Kind of the name On Point basically says it all, is they're on site down at the casinos. People come in before their shifts, after their shifts, during their shifts, as a kind of full wellness-based clinic, and that's incorporated within their day-to-day activities. So, and it saves them a ton of money on workers' comp claims, because a lot of those workers' comp claims cost upwards of $1,000, $5,000 just to walk into that clinic. So that's huge. Another close therapist that I worked with before works for one of these wellness clinics for older adults, Nifty After 50. I think they're a bigger corporation, so they have multiple locations across many cities and states. But they've developed it's a clinic that's run through their insurance, and it's both a therapy clinic and a wellness clinic. So the patients come in, they do their therapy for a certain amount of time, and once they're up to a certain functional level, they get discharged to a wellness portion of the clinic where they're coming in continuously for just regular activity and exercise. Kind of what we all harp on about our patients. Stay active. Keep doing these exercises to maintain the benefit that we gained from here. this clinic has captured that and said, okay, you're already coming here. You already know the people that are working out here. It kind of becomes a social hour for them as well. They get to see their friends. They get to exercise. They get to play fun games, things like that. So they've created a kind of whole unique atmosphere there where they've captured that. So look out for things like that. Another therapist that I went to school with up in Washington has general fitness type classes, boot camp classes and things like that she works with at the park, at certain gyms, things like that. And from the unique perspective of being a physical therapist, so she can catch those bad mechanics from these patients or these clients that are coming in to work out as a general workout, to lose weight, to get fit, whatever their specific goals are. But typically they'd go to a regular gym or boot camp and not really have any feedback on form and function and modification, where, well, she's incorporated that physical therapy education to say, listen, this is the way we should do this, or, you know what, I see you compensating here, let's switch it for this. So that's pretty neat. Another one that we just got to meet with recently is kind of this new age elite physical therapy, the Movement Performance Institute under Chris Powers, with utilizing technology that's out there now and bringing a new level of evidence into the clinical practice. So that's also out there, bringing in 3D motion capture and force plates and really truly grinding out the nitty-gritty numbers to identify what exactly is wrong with a person and showing them and being able to show them almost real time where their issues stand.
Legendary.
Yep. Something that we've started now is a concierge cash pay kind of clinic, and there's many other places that are doing this now and kind of breaking away from the insurance mold and breaking away from the kind of shackles that insurance companies put on clinics and clinicians, as well as gym-based type clinics, which we're also doing is partnering with local gyms and working with them to see their clientele, to train their trainers and kind of bring up the level of athletic services and exercise services in town, to provide that kind of out-of-the-box treatments. So, and another big thing, telehealth. It's not necessarily approved in a lot of states. Here in Nevada it is, so this is going to be a huge thing down the road, is developing our space and our position and our kind of our expertise within that new setting of telehealth. You know, a lot of physicians are already doing it. A lot of bigger health systems are doing this in the realms of mental health and you know, long-term medical management of cases. And that's essentially what we want to take physical therapy to anyway, with, you know, every 6-month follow-ups, a year follow-ups, yearly kind of therapy evaluations to see what things are going on. Telehealth can build right into that, especially for rural communities where they can't necessarily make it into the gym 3 times a week. Maybe now using telehealth, you can still follow out them 3 times a week, but they only need to come in maybe once every 2 or 3 weeks, depending on the needs of manual therapy, et cetera, et cetera, et cetera. But that's another big way that we can kind of start challenging the status quo and not fall into the same ruts of patient mills and kind of going through that process. So at the end of the day, you new students are the future of our profession, and even young professionals that are just coming out of school that are within those first 5 years, you are the future of our profession. You can make a change. You can kind of steer and guide us in a new direction. So it's up to you guys whether you fall into the same kind of rut and become part of the problem, or if you step up, be bold, and change what's going on out there.
And we as a profession, we as individuals, again, we need to take responsibility, and we have to point the finger at ourselves. You know, we have to take action. We currently have given all the control and the power to insurance companies, to doctors, to everybody else. It's not in our hands. The only way that's going to happen is if we do that. We have to start challenging the insurance companies. We have to start challenging all these things if we want things to change. And we need to do it as individuals, and we need to do it as professionals and as an organization. Again, those APTA dues are not worthless. All right. These are all the things that we need to start doing if we want the value of what we do to mean more. Again, go back to your why. You know, why are you doing this? You know, do you want to be happy doing this? You know, do you want to work in an environment that you are happy with. All of the things that we can do to change that, we have to start doing. And that starts with us.
So thanks for taking the time to listen. We'd appreciate any kind of feedback you have for us. It's the first time we're kind of doing something like this. So from the technical side of things, clinical perspective, from our thought processes, just feel free to leave comments or reach out to us directly via email. We'll post all of our information as well, so you guys can kind of reach out and kind of open up the dialogue. Thanks again.
Thank you.